Hi, welcome to week 2. I'm going to be talking about GLP medications and understanding functional weight loss. My name is Sherry Stoka, and I'm a registered dietitian, nutritionist, and functional nutritionist. And I really look forward to this presentation because it will really help you understand a little bit more about what the medication does and how our body can best respond to it. So I will go ahead and get started with the objectives. So today you're going to better understand the root cause of weight loss resistance. You're going to learn what GLP receptor agonists are and how they work. I'm going to discuss the mechanisms of action and metabolic effects, discuss different fat stores and how some are resistant to weight loss. And I will discuss some common side effects and what you can do about it. So it's really important to understand that, and most people understand this, that obesity is multifactorial. So there are many different things that come into play. And the first and foremost thing that is problematic and contributing to it is the standard American diet. We know it's ultra processed. We are very far removed from eating whole foods the majority of the time. So that is really affecting the entire body foundationally. So our lifestyle habits also contribute. Stress and sleep are also foundational. You can be doing all the right things, but if you're not sleeping at night and your body's in a constant state of stress, that is really going to hold you back. We live in a toxic world. Our food is, again, full of processed chemicals, but we also are exposed to environmental toxins, in our skincare products, in the air we breathe, in the water we drink. And so it's just really important to be mindful of all of the different places that you can be exposed to these things. The majority of people now have gut issues. Really, we can, that is largely contributed to the standard American diet and again, what is put into our food. So the gut is foundational to the human body. So if the gut is unhealthy, really the rest of the body is going to be unhealthy. It's just like the image that you see, the gut is just like the root of a tree. So we have to get the root of the body healthy so that everything else can thrive and flourish. Hormone imbalances are affected by these imbalances in the body, our mental health, and at the end of the day, we are overfed and we are undernourished. So our goal for you is really to help you understand how you can treat the foundation, because if the foundation is not rebalanced and healthy, then weight regain is going to be it's going to be more likely that you regain weight. So we don't want that to happen. You may have or may not have heard, but 99% of Americans now have some type of metabolic dysfunction. And so that means many different things. It could just be your high blood pressure. It could be your high triglycerides or high blood sugars when you go to your doctor and have that tested. You could be experiencing autoimmune conditions. You may have diabetes, which is the ultimate case of metabolic destruction. Mental health issues, hormone imbalances, inflammation, gut issues, these are all a sign of metabolic dysfunction. And obviously it's a little complicated, but what's important to understand is that it starts somewhere. And if not addressed, it continues to progress and affects other organs and systems in the body. So we talk a lot about our medical system and how it is designed to just give you a pill for every single condition. And so we're going to really help you understand that, that is not the always the best route to go when a lot of these conditions are really easily remedied by just cleaning up some things and making some lifestyle changes. You get out what you put in. So if you eat crappy, don't expect to get good results. And with the GLPs, unfortunately, a lot of people are still losing weight by eating crappy because they're eating less, but they don't realize what they're actually doing to their body, during that period of time. And then when they complete the program, those are going to be the individuals that gain it very, very quickly back, and usually a lot more than when they started. So the obesity talk track, the obesity narrative that you hear out there, you hear in the news and the media, is that obesity increases your risk of all of these things, of cancer, heart attack, high cholesterol, high blood pressure, etc. But that is actually not true. Obesity is not, the reality, okay, so the reality is that obesity is the result of all of these long-term metabolic conditions. So again, it's important to know that it starts somewhere and then it progresses, and it progresses into a worsening metabolic state, and then you get to a point where now you are in an obese state and it's almost impossible to lose weight because of all of the dysfunction in the body. The body does begin to slowly adapt to altered metabolic processes. So that is why, when you try to just lower your calories and exercise more, it no longer works. The body is not supposed to go to muscle for energy. So we have different energy stores in our body, and we have readily available sugar, glucose in our body that we use for energy when food is not coming in. And then after we exhaust those sources, then we are supposed to go to fat stores. And unfortunately, that really no longer happens because of the imbalances, inflammation, and things like that that are going on in the body. So if you look at this image, this is highlighting one of our body composition analysis for a particular patient, because we're always looking at weight, body fat, and body fat mass in pounds and muscle mass, as well as visceral fat. But what I wanted to point out in this particular image is that you can see in this image here that the muscle mass for this particular person, or I'm sorry, the body fat mass is 101.9 pounds. So we definitely know that there are approximately 3,500 to 4,100 calories that are stored in 1 pound of fat. So in this particular person, they have over 400,000 calories stored in their body. So there is absolutely no reason why one should start burning through muscle. It just shouldn't happen, but it's happening all the time. And again, it's because of all of the different imbalances and the fat cells that I'm going to talk about. So all fat is not the same. We have healthy fat cells, and we have unhealthy fat cells. So the majority of people, that are struggling with weight and are unhealthy have a large number of these unhealthy cells, which are, what we consider white fat cells. So they have larger fat droplets, and they're designed to store energy, store calories. They have what you see, these are called the mitochondria. All fat cells actually need to be moved into the mitochondria in order to be burned. And so as you can see, this large droplet is likely not going to be transported very easily into the mitochondria, and there are very few mitochondria. Whereas you see this healthy cell, which is called the brown fat cell, and they are smaller lipid droplets, and there are numerous mitochondria. So these fat cells are constantly being burned for energy and actually provide a lot of benefit to the body. So again, when you look at the overall picture of most overweight or obese people, they unfortunately do have a lot of the white fat cells. And the white fat cells are going to find their way in the visceral area. So visceral fat, you may have heard, the belly fat, the deeper belly fat. This is the fat that surrounds all of your vital organs. your liver, your stomach, your intestines, your pancreas. So when that happens, those organs no longer function as they should, and they do many damaging things in the body. They increase systemic inflammation, they increase your risk of insulin resistance, and they signal to your hunger and stress hormones. So that's why most people that have a lot of visceral fat, they're hungry all the time, they're stressed all the time, they crave sugar because the signaling is no longer happening as it should. The subcutaneous fat, very different from the visceral fat. The subcutaneous fat is the pinchable stuff. It is the fat that most people don't like. I mean, nobody likes visceral either, but the subcutaneous is not as damaging or destructive to the body. It can over time if it begins to become excessive, but for the most part, subcutaneous fat is non-inflammatory and really doesn't contribute again to metabolic dysfunction. So visceral fat is a huge problem. It is, again, the belly fat. It affects the whole body. And because the body is protecting itself, it doesn't go to visceral fat when it needs energy. Visceral fat being very inflammatory, being kind of the dumping ground for different chemicals and different processed dye. I mean, we store so much in our visceral area, so the body protects itself and does not readily use, or is not even able to use, visceral fat as an energy option when needed. And there's many other reasons why that is, but just understand that even though you might have a lot of visceral fat and you're wondering, why can't I burn this fat? It's because it's very resistant. It can't enter the mitochondria. Like I mentioned, it becomes the dumping ground for toxins. And this is the vicious cycle that patients cannot get out of because of this imbalanced state. So again, this is why lowering your calories doesn't work. When your body needs calories, it will identify subcutaneous fat. It will identify, glucose that is stored in our muscle. It'll use glucose that is stored in our liver, and then that will stop and it will want to go to fat, but it doesn't recognize the visceral. So that's where you are at risk of losing muscle, because it will go to the muscle. Fat stores, fat cells, they change as we age, and in menopause specifically, there is quite a dramatic change in fat cells. So fat cells basically stabilize in adulthood. However, you can actually create more fat cells. Your body can create more even after kind of that time frame if you're constantly providing too much, calories. Women have more fat cells than men. And that's for obvious reasons. We need to, have certain fat cells in certain areas to carry children and that type of thing. The larger fat cells so the larger the fat cells, the more inflamed. So if the fat number of cells that you have, if you're again eating and putting in too many calories, those fat cells will begin to get larger and larger. And the larger they get, the more inflamed they get, and the more insulin resistant they become. So now again, your body is in that fat storing mode, not in the fat burning mode. In postmenopause, so premenopause, again, women have a large number of fat cells, and then postmenopause, those fat cells stabilize, and then you're left with what you have. These fat cells then become more estrogenic. And again, if you don't change your diet or your lifestyle and you keep consuming excess calories, now again, those existing fat cells will start to become larger and larger, and those are stored in the visceral area. So that's why a lot of women will complain of that area. We hear it over and over and over that it never used to happen, and since menopause and the changes now, you can't stop, it's impossible to lose that weight. Well, that is why, because the visceral, now that the fat cells have changed from subcutaneous to visceral, now the visceral is resistant. So insulin is foundational. We do a lot of education on the importance of insulin. So what I can just recommend to you is make sure that you're asking for a fasting insulin test at your next appointment with your doctor. Our our medical system does not check insulin because we don't have a medication to give you for it. So unfortunately, that's another little rabbit hole, but it is going to be really important that you advocate for yourself because you might check blood sugars, you might go in and get your glucose levels checked and your doctor's like, wow, yeah, your blood sugar looks good. But the blood sugar is not even accurate if you don't know what your insulin levels are, because if your insulin is elevated, it's because it's overworking to try to regulate your blood sugar. So while you are in this major metabolic destructive state, everything you consume is going straight into fat cells because of the high insulin. Your doctor could tell you that everything looks fine, but at the end of the day, you really don't have a good picture of what's going on unless you have a insulin level checked. So metabolic dysfunction, it all begins from sugar regulation in our body. We are designed every cell in our body needs sugar, needs glucose. And so what has happened in this day and age is that we are consuming sugar in everywhere. The processed food, there's sugar in even, non-sugar items. So we are getting these ebbs and flows, these spikes of blood sugars all day long. This continuous regimen of blood sugar spikes, okay, you eat something and then it goes way low, and then you become, now you have low blood sugar, now your body's gonna crave more sugar, so then you go for a quick snack and then you spike it again, and then it goes lower and you spike it again. So it's like this vicious cycle, and nobody knows what's going on because we're really not checking our blood sugars routinely, and we're not checking the insulin, but all of the destruction really begins with the ebbs and flows. And that's why the CGMs are very popular now, because you can start to actually see in real time what's going on with your blood sugars. All carbs convert to sugar, no matter what, healthy or not, all carbohydrates convert to sugar. Now, some will convert very quickly and spike your blood sugar quickly, while others, the healthier ones, the whole grains that have fiber, they have a more moderate spike. So the quality of your food is very, very important. So keep that in mind, because so many times people don't really understand, that all carbohydrates are basically sugar. Another important thing to understand is that, so carbohydrates, we know, spike our blood sugar, right? Protein has a minimal effect on blood glucose. So you can see the carbs, big spike, protein, minimal here. There are really, if it's just animal protein, there's no carbohydrates in protein. However, if you eat a lot of protein, the protein can get converted into sugar and cause a spike in blood sugar. And fat, so just a natural form of fat, butter, oil, some other, like some type of dressings, MCT oil. So just regular fat products don't spike blood sugars at all. But keep in mind, usually when we're eating fats, it's with something else. So you could get a little bit of a spike, but that fat content is going to help keep that spike, minimal. So hopefully that makes sense. So this is a busy slide, I know, but I do think it's important to kind of like try to digest some of it, because the root of metabolic dysfunction is the blood sugar regulation in your body. So insulin controls blood sugars. That's exactly, kind of how it works. Insulin is secreted from the pancreas. When the blood sugars get too high, insulin goes in, opens up the doors for blood glucose to get out and go into the cells to be used for energy. Unfortunately, what happens now is it's in excess, right? So when the blood sugars get too high, the pancreas is going to overproduce insulin. So now you're running into a state of hyperinsulinemia. When you have high insulin, your fat metabolism completely turns off. If you have high insulin, you cannot burn fat. You just can't. So that's why, again, it's very, very important to understand what your level of insulin is. I kind of already went through the different bullets. Sugar builds up in the blood, sugar. So when sugar kind of stays in the blood for too long, the body will do what it can immediately to get it out of the blood, because the body perceives that as, it's actually very dangerous for the body and can do a lot of destruction to the arteries and things like that. So we have a mechanism called lipogenesis that will convert sugar into triglycerides, which are fats, and they will shuttle that to the visceral area to be stored. So sugar gets converted into fat very easily when your body is not regulating sugar and not clearing the sugar on a regular basis. So this doesn't go into the healthy fat stores, right? This sugar converted into fat goes into those white cells. They become white cells and then they're stored in the visceral. So it is kind of like this, again, kind of that vicious cycle. So GLPs, what do they do for weight loss? They stimulate insulin production, so it's going to help clear your sugar out of your blood, which a lot of people need. It's also going to decrease what's called glucagon. So glucagon is responsible for actually increasing blood sugar in a time of need. So what this medication will do is actually shut that off so that your body isn't actually producing its own sugar. Okay, so the medication is doing two different things for the blood sugar control. It also signals to GLP receptors in the brain that controls appetite. Largely, the brain is very much involved in appetite control, in hunger, and that type of thing. So GLPs are signaling to the brain, and the brain is recognizing that that energy is stabilized, and we don't need to bring in more food. So that's where the appetite goes down. These medications also slow gastric emptying. So that means food can stay in your stomach a lot longer. So when you have food that stays in your stomach a lot longer, you feel fuller. But this can also be problematic for people who have reflux. It can be problematic for people who are constipated, who deal with constipation, because it's slowing everything down. So yes, it's beneficial because it's helping with fullness, but this is when some of the side effects you can start to see, nausea and things like that. So the question that really you should be asking yourself is, why aren't my GLP receptors being activated? Why don't I experience appetite suppression? Why doesn't the food noise go away? And the simplistic answer is a body out of balance and inflammation. Okay, so I'm not going to go into a lot of details about this, but the main reasons why your GLP receptors are no longer being signaled or activated is because of gut dysbiosis, so gut issues, or leaky gut. Inflammation. If you are obese, you have excess fat, you have low-grade inflammation. And inflammation is really inhibiting the ability for the receptors in our gut to do what it is designed to do. And again, when you have excessive visceral fat, that also inhibits the ability for the GLP-1 receptors to be signaled. Because when you look at a healthy individual, you don't have food noise. You don't crave food. Because that's a normal healthy state. When you're experiencing all these things, it's because everything is kind of all out of sync. And so at the end of the day, the goal is to, while you're on GLPs, is to really work hard to get your body into a healthier state. There are GLP receptors not only in the gut, they are everywhere in the body. And you can see the image. They are in our brain, they are in our lungs, our liver, our kidneys, our bones, our muscle, everywhere. So that is why people are starting to experience benefits in other areas of their body. So now people have, and there's studies that back all of this up, but a decrease in pain, a decrease obviously in food noise. That's a very popular one. There's an increase in energy, an increase in concentration and focus, a decrease in a desire for alcohol, change in taste preferences. I mean, we kind of see this a lot, even like unhealthy food. People are like, oh my gosh, I can't even look at those potato chips I used to eat, before. So that's very interesting. We've seen improved sleep. So there's some mechanisms that are more holistic happening all over that are really changing in a positive way. However, this is not like, oh, you just start doing it and then you get all these benefits. No, you have to be, every body is very different. You have to be managed appropriately. You have to be on the right dose. Very high doses of these medications that are advised by pharmaceutical companies can be very destructive. So that's why, working with us, we are so good at looking, really looking at the full picture. So some of the risks that you might hear about: muscle loss and nutrient deficiencies. People just are not eating enough. They're just eating less. And so they're not getting enough protein. And when you don't get enough protein, and again, you have a lot of visceral fat, you're just going to go to your muscle loss. Mental health issues. So there are some studies out there that are showing people that there are increases in mental health issues. I haven't dug into the studies. I've done a ton of research in GLPs, and there just hasn't been enough for me to go down the rabbit hole, because there just isn't good quality studies out there right now. What I will say is that these GLPs, these medications signal to different receptors in the brain. We know that it affects your appetite. We know that it affects certain desires for things. So some people will say that, these can just as it decreases your enjoyment for food, you don't have an appetite, it can also affect your enjoyment for other things. So maybe you enjoy jogging every day, and maybe now you're like, gosh, I don't feel like it. I don't have the motivation. So there is some of that I believe is warranted. We have not seen it, and we have been utilizing this in our practice for a very long time, but it is something to be mindful of. The GI side effects are absolutely real, but we really manage the whole patient. We manage the dose, we manage the diet. Everyone is very different. Not everybody has side effects. So just note that if you're on a GLP, or if you're thinking about starting a GLP, if you're managed appropriately, you can navigate this pretty easily for the most part. And then we hear a lot about the increased fat regain after. You stop GLPs, you gain everything back and more. Well, I'll just say that of course you will if you've lost weight and lost muscle and you are in a worse metabolic state. So if you didn't go on the program really looking to improve your overall health, and you looked at the GLPs as a quick fix, a Band-Aid, you're just going to take the injection and just eat less, you will absolutely gain the weight back. I mean, there's just no doubt about that. If you are learning better lifestyle habits, you're eating healthier, you're exercising, you're maintaining your muscle mass, you are in a healthier metabolic state, so you won't gain your weight back. It's kind of as simple as that. So who is a candidate? These medications improve metabolic function. And, you could have metabolic dysfunction 25 years ago because you were diagnosed with high blood pressure. That could be the start of it. So, you know, I believe that, I believe oh, there are a lot of opportunities for people to use these for different things. But the main conditions that people are using GLPs for are definitely prediabetes, PCOS, because that's insulin resistance, fatty liver disease, dementia, weight loss resistance, autoimmune disease, or anyone with some type of metabolic dysfunction. If you're taking cholesterol medication to control your cholesterol levels, that's metabolic dysfunction. If you have constant reflux and you're taking, omeprazole, that's metabolic dysfunction. So, there are a lot of people that can be candidates, but then obviously, the ones that are, FDA approved and, the pharmaceutical companies, these are really only designed for like last stage metabolic dysfunction, which would be obviously diabetes. And us being more preventative and holistic, we're like, let's see if we can fix and work on some things much earlier on. Who is not a candidate? So there are some contraindications, personal or family history of medullary thyroid carcinoma or a multiple endocrine neoplasia syndrome, very, very rare. And pregnancy is also a contraindication. If you have inflammatory bowel conditions, you must be managed. There actually are studies showing that it can help it, but it can go both ways. It can cause more harm or it could help it. So you just have to be managed really closely. Pancreatitis or a history of pancreatitis is definitely it has to be watched very closely. We typically will not start anyone who is dealing with pancreatitis. As well as like current like gallbladder disease and that type of thing. Gastroparesis as well. If you have a history of gastroparesis, then the GLPs are probably not going to be a good fit for you because of the slow motility, and that's basically what gastroparesis is. It basically paralyzes the motility and food can't get through. Also, if you are having surgery, you want to stop the GLPs 2 to 4 weeks prior and 2 weeks after. And some other precautions, if a woman is on birth control and trying to prevent pregnancy, they should really talk to their doctor because GLPs can actually inhibit the absorption and the basic mechanism for birth controls to actually work. And then just severe constipation also, just because it goes back to the motility issue. And so it can worsen the problem, but that doesn't mean that if you have severe constipation, you can never be on these. You have to find out what's causing the constipation, fix that, and then typically people are fine. Common symptoms and side effects. So we will see constipation, reflux, bloating, fatigue, nausea, sugar cravings. So these are all typical side effects. Again, not that everyone experiences it, but this is what you can expect. Some tips and tricks. If somebody is experiencing constipation, we're recommending magnesium citrate, warm lemon water, adequate fiber, adequate water. So just kind of some of those simple things. If you have reflux, you definitely want to address the constipation. Drink liquids between meals because reflux is usually due to low stomach acid, not high stomach acid. Again, despite what we're told. And when you drink liquids with a meal, you're further diluting the acid in the stomach, and that could cause more reflux going up. Apple cider vinegar can work really well. So 1 to 2 times a day. And at the end of the day, you want to wean off of the reflux medications because reflux is actually helping the symptom, the feeling, but it's worsening the problem. Bloating. First thing, if someone has bloating, I say avoid all dairy and gluten. Chew your food thoroughly. Do not eat on the run. Reassess your liquids. Again, these are just very basic guidelines and just tips that you can try. If you're experiencing fatigue, you have to really look at your diet. You have to look at the timing of your injection. you might be deficient in electrolytes or just salt in general. Nausea, you want to eat smaller meals, low-fat meals, avoid spicy foods, consider peppermint oil or peppermint tea. Ginger and lemon teas can be really helpful as well. So the summary is GLP agonists are peptides that aim to mimic normal physiology, but they are not exact. They are close, but they are not exact, especially because of the dosing. The dosing can go pretty high. GLP-1 agonists support metabolic health if you're doing all of the other things. If you're eating high sugar, high carbs all day long, these are going to have a really hard time working for you. They can improve other conditions as well if applied correctly and, again, in concert with other foundational interventions. GLP-1s can treat obesity and prevent obesity, but you must be metabolically healthy to sustain the benefits. Benefits of GLPs, like I mentioned, they far exceed just weight loss. Again, people start to notice like all different things that they just feel good on these. And so, if that happens to you, that is, you're not the only one. We definitely still need long-term data on some of the medications. So semaglutide has been on the market for over 20 years, but the newer medications, so tirzepatide, retatrutide that's going to be coming out, these are brand new medications. These are ones that are new to the medical system. And so we need to be a little cautious with that because we definitely don't have long-term data on those meds. So we will be providing you with some resources. Hopefully that will help you as you are on the GLPs. And if you have any questions, of course, we are always here to help answer any questions. And that is about it. I thank you for your time. Have a great day.